It's great to see you all here. My name is Mike Froman. I'm president of the Council on Foreign Relations, and I'm delighted to welcome you to our conference on expanding access to international affairs. I'm sorry I missed the event last night. It was my daughter's middle school graduation, and I thought you would all understand if I came this morning instead. This long-running conference is a pillar of the Council's goal to cultivate the next generation of diverse foreign policy experts. It's one of our core values of the Council, and that is inclusive excellence, a term I learned from Sylvia Matthews, or Burwell, who you'll be hearing from a little bit later, bringing together the most talented experts and practitioners in the field, regardless of background and perspective. Indeed, I want to emphasize the importance of having the United States represented in government, in business, in think tanks, in the nonprofit sector, in education, by people who reflect the wide range of perspectives and backgrounds of the country. And the Council works to do this in a number of ways. We have our International Affairs Fellowship Program for early and mid-career professionals to come from academia and elsewhere and go into government, or come from government and spend time at the Council or at a university. We have our term membership program, which brings in, again, people sort of young, mid-career, in their 30s, to be CFR members for 5 years. It includes our Young Professionals program, a relatively new program where we try and bring people who are even younger than term members, people in their 20s who have an interest in these issues, and bring them into the CFR ecosystem. We are working to engage a broad range of perspectives and viewpoints in all of our meetings and events, on the pages of Foreign Affairs, in people writing for our websites. And we're seeking to involve teachers, professors, through our education program, congregational and religious leaders, local journalists, local and state officials, through our outreach program. So bringing people with varied backgrounds from around the country into the Council in one way or the other. And this commitment goes to the Council itself, from our paid internship program, which allows students from a broad range of backgrounds to gain exposure to the Council, to our research assistants who spend 2 or 3 years here after graduation, to our staff at all levels, and to our leadership itself. Over the last 2 years, one of the things I'm most proud of is that we've built the most professional and diverse leadership team in the Council's history. So there should be no doubt where CFR stands on these issues, yesterday, today, and tomorrow. And in that light, I'd like to acknowledge the relationship the Council's had with ICAP, GAP, 2 organizations that help us with audience development for this conference. And Tom Rowe, where's Tom? There you are, right there, right in front of me. I'd like to thank Tom in particular for the partnership that we've had over several years and the collaboration, and look forward to continuing that going forward. This morning, I'm pleased to welcome 2 longstanding friends for this session. Dr. Helene Gayle, who is President Emerita of Spelman College, former CEO of CARE and the Chicago Community Trust, and a former member of the Council's Board of Directors. She's made her mark on global and domestic public health issues, poverty alleviation, gender equality, wealth inequality, among many other areas. And we're very fortunate to have her back at the Council this morning. We're also joined, our moderator this morning is CFR board member Sylvia Matthews Burwell. She is currently a senior lecturer at American University and the former president of American University. But she also served as director of the Office of Management and Budget and as the Secretary of Health and Human Services. And I have to say, there's no one more responsible for my career than Sylvia, because every time she was given a promotion and given a new job, I was given the opportunity to try and fall in behind her. So I'm very grateful to Sylvia for her success and for all of her support over for these many years. Before I turn it over to them, though, I just wanted to thank all of you. This is the first time we've done it in New York. There was a lot of demand for us to experiment with this, and I'm delighted that we have such great attendance here and online. I hope you'll take full advantage of the sessions, both the substantive sessions and the networking sessions. And I hope in one way or another, you'll view the Council as part of your family, and that you'll find ways to plug into the Council throughout your career going forward. So welcome to the Council. Thank you for letting me interrupt the flow of the conference with some remarks. And let me invite Sylvia and Helene to the stage.
you. Thank you. Well, good morning. Good morning. And Mike, thank you so much. And want to welcome everyone to this keynote. And glad everyone's here in the room and also online to this important time and period in this conference on accessing, continuing to expand that access to international affairs. I want to welcome our guest for this keynote, Dr. Helene Gayle. And Mike did some of an introduction. I will do a little bit more just on a couple things because I think it'll help you all as you think about your questions as well. Helene, you hear the title doctor. She is a doctor. She is also a master's of public health as well. You heard some of the things she's done. Helene also served in the most senior ranks of the Centers for Disease Control. We'll talk a little bit about that in some of my questions. She also worked at the Bill and Melinda Gates Foundation, where Helene led the efforts on HIV, AIDS, and TB and malaria for many years as well. So her career is wide-ranging. She serves on corporate boards as well, and we'll probably get into a lot of that, but wanted to add it. And I guess the other part of the introduction is that I will just add that Helene, from a personal perspective, because like knowing Mike for so many years, have also known Helene for many, many years. And I was thinking about that from a personal perspective, and I thought about two words: gracious warrior. And the gracious part of that has to do with how Helene approaches the world and people, and her deep understanding of people. And the example, I was thinking, well, when you say these things, you need to give examples. And I thought about, Helene will remember our first trip with Bill Gates to India, where the Bill and Melinda Gates Foundation was opening the first effort in India to work on HIV. And there weren't organizations from the US that were allowed to go in. And so we were working hard to get into India to do this work. And we brought Bill with us on this trip and, as part of this effort, so he would be engaged and he could help us do this. And Bill was a little skeptical on stigma. Mm-hmm. And Helene, this is one where I think her grace, you could see Helene's grace in understanding people and what stigma means and why. And you could see Helene's grace and patience with Bill, who didn't think stigma was an issue at that time. Both worked out. The effort was good, but that gives you an example. And warrior, in issue after issue, time after time, Dr. Helene Gayle has been, whether it's domestic issues at the Chicago Community Trust, international issues, Helene is at the forefront of constant effort where she brings that intelligence, that drive, that problem solving, and that moving towards impact. So giving you a little sense of the personal before we jump in. So with that, I want to start with, Helene, can you start actually up to 18? And can you talk about any people or events that help shape you in that 18 and before time?
Yeah, thanks. And first of all, thanks, Mike, for that kind introduction, and Sylvia for adding some of the personal. We could spend the whole time talking about personal anecdotes between the two of us. We had a lot of fun.
She's told me I can't share some of them.
We had a lot of fun at the Gates Foundation together, both kind of going out around the same time, coming from U.S. government roles and jumping into the world of private philanthropy. And I think it's fair to say we got each other through a lot of things, sometimes working things out on a jog in the morning and a variety of different things. But anyway, it's great to be back with my dear friend, Sylvia Matthew Burwell. And, so early influences, first 18 years. I think I would start by saying my family and my parents were, like so many of us, our early influences and made a big difference. I was fortunate to have parents. My father was a small business owner. My mother was a social worker. But they really believed that it was important for all of us to get a good education and to use that education in a way that gave back and made a difference and contributed to positive social change. Yeah, I'm in the middle of 5 children. I think that also was a influence. People talk all the time about birth order. Well, when you're the middle child, you often have to scrap for yourself, and I think that may be the warrior part of me, having 4 very, very vocal and achievement-oriented siblings. I think being in the middle of that also helped to shape me. But again, back to my parents and the community that I grew up in, I think there was a real and as a young African American woman, I think a lot of focus on how education was such a equalizer and being able to get a good education, but use that to give back to the community was really something that was a pillar of how I was raised, and raised in a community of people who had been the first in many of the things that they had done. So I had that sense that that there was no reason to put limits on myself, but in doing that, thinking about how does that really make a difference beyond just myself, but how do you use that in a way to give back? I think the times that I grew up in also influenced a lot of what shaped me. So, I grew up in the 60s and early 70s, and that was a period of very rapid social change, whether it was the civil rights movement, the women's movement, the movement for liberation of countries that had been colonized. All of those things really had a real impact on me, and I think it made me want to do something that was greater than myself, something that connected in a major way to some of the things that could create change. And I saw change happen, and I saw the differences that happened as a result of people coming together and all banding together. So I think both my family influence, but also the times in which I grew up, had a huge influence on me, and feeling like I wanted to have a career that I felt could give back and create positive social change.
You've touched a little on education, and it's interesting. I'm a second-generation immigrant. All 4 of my grandparents immigrated to this country from Greece. And this idea of education in our household, you learned before you could speak, education is the key to social and economic mobility as an immigrant family. And can we spend a little more time on this education? And as you went through and became educated, how did your education, including your post-secondary education, shape that life and career and the things that you have done and been able to do?
Yeah, so I went to. I knew I was going to go to college. I didn't know for sure what I was going to do. I at one point thought maybe it would be fun to be an actress, but I didn't think that was really that stable and that predictable. So I kind of put that aside. And then I went through a series of different thoughts about majors. I was a sociology major, then I was a psychology major, and I thought for a long time that I was going to do clinical psychology. But I went to a school, I went to Barnard College, right around the corner from here, where pre-med was really a big focus. And, they had wonderful rates of women getting into medical school at a time when medical school was still predominantly male. So I kind of said, I could do psychology, clinical psychology, take 6 years to get a PhD, or I could do medicine, where I felt like medicine probably would provide a more flexible career and maybe more tangible in ways. And so I kind of migrated from psychology to thinking about psychology, but also biology and all the other sciences that are necessary to get into medicine. And said I would strike out and take my chances in pre-med and getting into medical school, and I did, and that was the basis and the start.
And how did this kind of evolve into your engagement in international issues? You were from Buffalo, New York. You're in medicine. One can see a path that could be very different, but you end up engaging deeply in international issues. How does that occur on your career trajectory?
Yeah, so I think there are several different influences. One, even while I was still at home, my mother used to bring international students around, and I didn't think about it at the time, but that really gave all of us a sense of, better knowledge and connectedness to the rest of the world. And I remember several of these students that we got very close to, and I think that gave us a basis and an understanding of how important it is to connect with the rest of the world, and some of it just through the personal connection that we got in our home. I also, as I started thinking about my career in medicine, wanted to have something that allowed me to have impact beyond the individual. When you're a clinician, your patient is an individual. But when you do public health, your patient is a community, a nation, or a world. And, I really, partly, I had always been very politically, and I don't mean that in a partisan way, but really active in student affairs and other things, and really, always wanted to do things that were about the group and how do you have an impact on the group. And so, in public health, you think about impact at a population level, not at an individual level. And so then I, extended that to thinking, if I'm going to think about greatest impact, it isn't just here in the United States, but it is also globally. How do you have impact on diseases that affect the whole globe, and engage in that way? So I think all of those things, from having international students come to our house and understand the global world, to wanting to have an impact more at a group level than an individual level, really extended the work that I did in public health to really thinking more about global health. I'll also say, just as I mentioned before about the times that I was growing up in, it was a time where things like the anti-apartheid movement was really big, and I got involved in work in anti-apartheid. And so I think all of those different strands, and I think this is, when we talk later, maybe there'll be some questions about it. I do think that as I went through developing a career, thinking about how the different strands of your life come together to help to shape the direction that you go in, I think was very much a part of how I kind of came to where I ended up career-wise.
And taking that to a more specific level, so Dr. Helene Gayle has the rank of Rear Admiral Upper Half. And when I first met Helene, she moves to Seattle. I moved there first to the Gates Foundation. Helene joined. She comes out, unpacking the boxes in her office. I'm there, welcome wagon, and like award after award after award. But the best one, and the one I loved the most, was there's this huge frame that has her uniform from her Rear Admiral. And this is from her time at the Centers for Disease Control. Some of you may not know, but the Public Commission Corps, it's actually a branch and considered, there are ranks and that sort of thing. And so Helene has a uniform. It has lots of stuff and that sort of thing on it.
Which I don't wear anymore.
She doesn't wear it anymore, but a beautiful thing. But that brings us to the CDC, the Centers for Disease Control. And so how do you make your way to CDC and the likes of Bill Foege and many people who, Bill Foege is the person who is often attributed with getting rid of smallpox, who is one of Helene's mentors and mine as well. But how did you get to CDC?
So I did medicine. I did my medical degree and I did my public health degree kind of all at one time. And then I did a residency in pediatrics and specialized in pediatrics. When I was finishing residency, I kind of thought that it was great that I had this master's in public health, but I had no practical experience in public health. I had practical experience in clinical medicine because, you do that throughout medical school and then you do your residency. And so you have a real strong background in clinical care. The CDC has a program called the Epidemic Intelligence Service, which is a 2-year program that allows you to get practical experience in public health. And so I said I'd had the experience, hands-on experience in clinical medicine. Let me go and do this kind of hands-on experience in public health at the CDC. And the Epidemic Intelligence Service is actually has always been one of the ways in which people who have clinical backgrounds break into public health. And so a lot of public health heroes and people who are my mentors all went through that program. So I thought I would go there for 2 years and do the program. I got there and really just felt like I had found my professional home. And so I stayed for 20 years. And I went there at the time that the HIV epidemic was first starting to unfold. It was back in the days when, we didn't even know that it was a virus that was causing HIV, that was causing AIDS, and, a lot of discovery and early kind of discovery and epidemiology to understand the HIV disease. And it was funny because when you go to CDC, you have this whole process of selecting where you want to be, and then the department decides who they want, and if you have a match, you end up in a particular program. Well, when I went and we had this whole process of the new people coming in and having different programs come and talk to you. And I said, I thought, it would be interesting to do HIV. And people said, no, don't do HIV. That's this political disease and it's not going to last very long anyway. And go do something that will really give you good public health experience. So for the first couple of years, I actually did do other programs more focused on pediatric public health diseases. When I decided that I wanted to stay, that was when I realized, and I think it was very clear, that HIV was going to be the kind of major public health challenge of that period. And so I went into HIV because it is also such a global disease. It was the opportunity for me to get more hands-on global health experience as well. It's what then led me to the Gates Foundation. So it was, again, I went for 2 years, stayed for 20. It was a wonderful opportunity to do a variety of different roles and, get a really firm foundation in public health.
And then at the Gates Foundation, Gates, is looking for a world expert on HIV. And then Helene is brought in to lead all of that work. Often in these conversations, it's all sunshine and all that stuff without kind of getting to like the real deal. So Helene and I discussed we need to do a little real deal. I'm sure you all will press us to do that as well. But wanted to talk a little bit about the challenges. As you go through and as you do these sessions, we often highlight all the great things and the many incredible accomplishments. But we both know that there are challenges along the way. And so, Helene, if you don't mind, could you please kind of talk about some of either some of the largest thematic or tactical challenges that you've faced in terms of your career and your work?
I think, there are a variety of challenges. First and foremost, I think that the kinds of big challenges that you take on when you're focusing on something like a major global pandemic or other things is just that being able to show impact and demonstrate that you're making a difference when sometimes you don't have all the tools. I mean, we have a lot more, take HIV again as an example. I mean, we have a lot more that we can contribute today because of the drugs that have been developed and, a lot of the strategies that have been developed. to prevent HIV and to prevent the development of the disease AIDS. Well, 20, 30 years ago, we didn't have that. And we were working with issues that were very challenging. You mentioned the issue of stigma. Huge amount of stigma in the early days of HIV. People didn't want to let people know that they were infected. There was a lot of stigma and discrimination. It's hard to do behavior change when people, are reticent to even let others know that they were infected. So there were a lot of challenges. When you're trying to change behaviors like sexual behaviors, et cetera. Just a lot of difficulty in that, and a lot of difficulty in demonstrating impact. When we're at the CDC, of course, a government agency, we had to go and defend our budget every year. The question that was asked all the time: how do you know you've made a difference? What can you do to actually measure that? So I think the ability to show impact is very difficult. I think just in general, the fact that public health is not always regarded as valuable as curative medicine. When you have a disease, it's tangible. You want to get better from that illness. But prevention is actually a non-event. And if you're successful in prevention, it's hard to demonstrate that you're successful. People don't often want to, and we saw that with COVID, for instance. If you're well, you're not thinking about, okay, I want to take a vaccine that may have some side effects, or I may not want to do preventive measures that are difficult for me to actually adhere to. So, I think the very nature of prevention, which is if you're successful, nobody knows that it exists, is a much more difficult field to work in sometimes than, you're sick, you go to the doctor, you take medicine, everybody values that. And I think just how to be able to demonstrate the importance of public health, the things that we take for granted, having safe and clean water, having surveillance systems that tell us when a disease is occurring and there's an increase. So all of those things that I think are really challenging to demonstrate with public health.
Start thinking about your questions, because I'm gonna finish up in a couple more questions. So please be thinking about what you want to ask. While we're in the space of challenge, just one more turn of the crank, and that is personal trade-offs. And we often don't actually talk about those things. That there are actually trade-offs sometimes in the choices that you make, and I think that's an important thing to kind of think about at the front end. Which is why we thought it would be an important thing to talk about today. You want to talk about some of
like my personal trade-offs?
Yes. Well, or just in general, the kind of yes.
Right. I'm not going to divulge everything, but I think first of all, international careers are hard. You spend a lot of time on the road, or you end up uprooting and living in some place that may not, have all of the same luxuries and way of life that you have here. So it is a field that you have to think about. What are the personal trade-offs? If you're on the road 60% of the year, what does that do to thinking about your family and family life? So I think, the time pressures, the travel pressures, the oftentimes being in environments that are uncomfortable or difficult to live in, are some of the things that I think when you think about an international career, one has to have your eyes wide open to realize, all right, it is different to have a international career that has these different time pressures, time constraints, et cetera. And what does that mean for you? And how do you plan your life? And I think, it does, sometimes it means that you don't do an international career at all. But I think more often it's really how do you structure it so that you can make sure you're getting the personal things that are important to you, a family, children, whatever those things are, but at the same time being able to develop a career. And it may mean, and I've gone back and forth between domestic and international in terms of work. So there's ways of building a career that allows you to have some of the personal rewards or the personal things that you want in your life. But I think you have to be eyes wide open about that and realize, that there are different pressures than if working in one city and, have a job that's a 10-minute drive away, very different lifestyle than hopping in and out of planes and in and out of different continents.
Yes, get used to the double overnights.
Yeah,
You learn.
and jet lag and, all
yeah,
those
all
other
those
things.
Helene, and this will be the last, and then I want to turn to you all. I think probably out here there are people who want to be the world's expert in a field. There are people who want to serve at the highest levels of government. There are people who want to run some of the world's largest NGOs or companies that have international components to them. And what would your advice be to these folks if you were just kind of trying to give some general advice?
Yeah, I would say, and this may not speak as much to being a specific expert. I mean, I think the way you get to be an expert in any field is to stick with it, learn as much as you can, have as many experiences that allow you to really understand the arena that you're interested in. I think, I think that's a large part of being an expert is just kind of staying the course. But I also think that there's value in, again, as I was talking about, kind of pulling different strands together. And, when I look at my career, very little of what I've done has been planned. Much of it has been opportunities present themselves. And I've been willing to see that there's some value in an experience that may be very different from what I'm currently doing, but gives me the breadth of experience. And I think being willing to take some risk. And, I remember when it took me a while to go to the Gates Foundation from when they first started asking me to consider it, because I was at CDC, I'd been there, it was comfortable, I enjoyed, the arena that I was in. And thinking about leaving government, which I thought at that time, since that was, how I'd started my career, I thought, being in the middle of government was the best way to do anything. And I was really focused on it. And why should I uproot, move halfway across the country to Seattle, to a place that I'd never lived in, to this little entity that, was being started. At that time, we went when the Gates Foundation was very, very small and a new entity that didn't have the clout and the influence that it has now. So, it was a big decision for me to move and take that step. But it was the best thing that I've ever done, because I think, after 20 years at the CDC and being in that universe, to go to a very different environment, private philanthropy based on two people whose career had been in business in the private sector. I learned so much. And I also learned that there is no one universe that is the center of everything, that every different type of institution, and I've been in government, I've been in private philanthropy, I've worked with the private sector, I've done community philanthropy. So, excuse me. So for me, having those different kinds of experiences are what has allowed me, I think, to continue to advance career-wise, but advancing career-wise was never the goal. The goal was really, again, how do you have impact and how do you do that from a variety of different vantage points?
All right. We're going to turn to you all now. I want to remind everybody, oh, good.
Oh, my.
Sian La, this is on the record, just so everyone knows in terms of that. And we also are going to watch for our questions online as well. We're going to start here in the room. When you get the microphone, if you wouldn't mind, please introduce yourself first, and then let us know what your question is. I'm doing the calling. Okay. Why don't we start here in the front? And we're going to come to the back.
First, I just have to say thank you both for speaking. I'm Brandon. I'm at American University right
Oh,
now.
wow.
Go Eagles!
Go
Once an
Eagles.
Eagle, always an Eagle.
Yep. And I have to say, it's great to see you again. You may not remember, but 2 years ago, you signed the 6-foot beach ball I was rolling around the campus quad.
Totally. Of course I remember that.
Wonderful. Yeah. So I was the guy pushing it. So good to see you again. And I just also, for my question, I think it's a little more simple, but we're faced with a lot of sobering headlines in recent days. I want to know, what is it that's giving you hope about the future? And more specifically, how do we fit into that?
Great, I'll answer it. Be great to hear yours reflections as well. I mean, when I look out in a room like this, it gives me hope and optimism. The last role that I was in, I was president of Spelman College in Atlanta. And people would ask me the same sort of thing. In a world that has a lot of disappointments, how do you keep the optimism? And for me, it really is the next generation. And as I look out and see all of you, and I think about the student body at Spelman and other schools that I've been associated with, you come in both with a greater knowledge base, just because we're all accumulating more knowledge and more facility with technology, but you also are here and wherever you are because you believe that you can have a difference, that you believe you can contribute to the world. And so I just think that each generation provides that kind of optimism for the generation that may be a little bit more tired, having fought a little bit more wars. You're more prepared, and I think in general more global thinking than the last generation, and I think that's incredibly hopeful as well.
Yes, completely. You all are fresh, and on the other side, in terms of the thinking about the downside and that sort of thing, the one thing I would just add is to think about is it's just so important to not let your emotions be what drives, in the sense that there are many things that aren't, we would be, I think, not being truthful if we didn't say there are many things that are troubling. But take that troubling and channel it. Channel it to, what is the outcome you are seeking? Why is this troubling to you? And what is it that you're seeking in terms of outcome? And think about, use all that talent, use all that energy, use all that you've learned, use all of the people around you to help you think about, how do I get to a different outcome? And I think that's one of the hardest things in a time like now, in terms of that. But it is about that challenging and being directed. Mm-hmm. All right, we're going to go in the green right here. If you can stand up maybe so you can get a microphone right here. Yes.
Thank you so much. My name is Shauna McLean. I'm in the Georgetown School of Foreign Service. There's been an increasing...
A good place too.
There's been an increasing incidence rate of wariness in medicine, especially preventative medicine. And I'm wondering if you have any strategies that you found most effective to combat not only misinformation, but that mistrust on the community level.
Yeah, I think there's the fatigue and then there's the mistrust, and there's a lot of challenges that I think go into the practice of public health in general. I always took my inspiration by having the network of people who who strongly believed in the value of what we were doing. And I just feel like building those networks is so important, particularly in difficult times, because it's easy to get dispirited when it's just you. But when you kind of band together with others who, believe in the value of what you're doing, I think it does help a lot. I also think just continuing to stay close to the data and the facts also is very helpful, even while there's a lot of misinformation and disinformation. And I think at a community level, it's always important to really partner closely with the community, because I've always found that posing a challenge to a community, they come up with great solutions. And we often think we've got to be the expert and come in and have the answer. And I always feel like I get much better answers on how to deal with. I mean, I may be the expert in terms of the actual data and knowledge, but it's the community themselves that often find the solutions to things like misinformation and disinformation, or alienation from some of these things.
And I think building on Helene's point about community and this question of like channeling where you're going, you asked about preventative health and preventative medicine and thinking about where the community is. And actually, to be honest, also thinking about where we are in terms of make America healthy again, a phrase that one of my successors uses. And there may be so many elements of that I disagree with, but the parts that connect to community and why people are seeking preventative, like that's the thing to hook on. Like I'm trying to get preventative, I need communities. They have spoken. There is a reason that some of these things are out there and happening. There is a question that is being asked that let me be clear, vaccinations work and we should use them, so that I'm clear about where I stand on that. I think I speak on behalf of Helene too, but where is the part of the truth that connects to the community that can help you get to where you're going, to answer your question about and connecting it to the other question? Okay, all right, we've got lots of questions. Right here in the white shirt, you want to stand up? Row 2. Thank you. So just introduce yourself.
Thank you both for coming to speak today. My name is Rachel Peterson. I'm a visiting student at UC San Diego, but my home institution is Spelman College, so it's very nice to see you again, Dr. Gale. My question for you is, I know that you have many accolades and there have been many opportunities that have presented themselves to you. However, I also know that there must be opportunities as well that you have declined. So my question is, how did you differentiate between which opportunities were beneficial, and how did you make the choices on pursuing those opportunities? Thank you.
Great question. I always think that one should have kind of a basic philosophy and values around your career, and a clear sense of what you feel your purpose is, and be driven by that in a broad sense. And then, I think, so I've always kind of thought about, as I weigh different options, do I have something that can uniquely contribute to this role? If I don't feel like I can uniquely contribute and it doesn't necessarily fit in where I think, what my purpose is, then, it may be a great job, but it probably isn't the job for me. And so, I think it's that balance of understanding what you think your personal purpose is in this world, and does the job fit in that, and do you have something unique to contribute to it? And kind of as I put those two things together, that's usually help to guide me to whatever the next step is. And also, I think, is it going to provide me with an opportunity to grow and continuing to grow? And, even at this stage in my career, I'm always interested in continuing to grow and learn more that will allow me to be even more purposeful the next time around.
I would just add to contribute, learn and grow, fun. You need to enjoy.
Yes.
Yes. Mike is coming. We'll get back over this side.
Okay. Hi, I'm Leo. I'm asking my second question from second question of the conference. I'm an incoming freshman at Columbia University, so I'm glad to hear you went to Barnard. I had a question. Do you think there's a way to remove or lessen the impact of politics on, public health decisions? And what would be a practical way to do that?
Yeah, I think that sticking with the data is always the best way to, as much as possible, depoliticize things. So, if you are making a decision based on the information that is available, the best information that you have, and you follow that, I think it helps to depoliticize it. But I think in the broader context, in a world where we are increasingly divided and comfortable with our own echo chambers, I think we also have to work on how do we try to depoliticize information and information sources and really elevate sources that, again, are based on data and not based on personal preferences or politics. And again, back to the some of the comments earlier, I do think that working directly with communities helps that, because often when we're up here, we are kind of in these different battles. But when you talk to everyday people and people who have real concerns and who are dealing with real life situations, I think that also helps to break down some of the political divisiveness.
And I would just also, as we think about moving on from the facts to how people get them, and I think this room is different, because I was going to ask my question in this room, and I thought, no. Because if I asked you all where you all get your news, you all are such a select group, it's not going to work. But if I asked you all where either your sibling or your roommates get their news, and so this question of how information moves is the point. So facts, communities, that's why communities are so good. But as one thinks about how to respond to your question, it's starting with the facts, but then how we move information and understanding that you've got to meet people where they are in terms of that. I will say, when I worked on the Affordable Care Act, I spent a lot of time in barbershops and beauty shops. I was a Secretary of Health and Human Services, and I wanted to go to tattoo parlors, but my team drew the line in terms of trying to reach people where they are with the information that they need. Okay, this gentleman right here. Yes.
Thank you. My name is Josh Davis. I'm a recent MA grad from Georgetown University in conflict resolution, not from SFS, the Department of Government. We're different. So kind of building off the previous question, but recognizing public health as being a potential tool for soft power, should that aid be framed as an expansion or solidification of a sphere of influence, or just for the common good? Going to what's the top-down approach, what gets money flowing?
Yeah, I would say both. I think you have to make the argument that public health has value as it's a public good. It is important that we recognize why public health matters, but it's also a national security issue. It's a foreign policy issue. So, I think sometimes it's thinking about who is your audience, who are you trying to convince, and sometimes the argument for how it impacts our national security is a more powerful argument for people who are in the national security realm. I remember when HIV was declared a security issue and by the UN, and that was a point when much more resources started to flow, because people understood that it wasn't, quote, just a public health issue, but it also had national security implications. So I think it's you know, it's not an either or, it's really understanding your audience and really trying to blend both sides of that.
And Helene and I started in this work when you couldn't have even ask the question. So the first Global Health Fellow at the Council on Foreign Relations, we were together at Gates and we funded Laurie Garrett here at the Council. When the Aspen Strategy Group, many years ago, I convinced Brent Scowcroft and Joe Nye, God rest both their souls, that they should do, this was an organization that was started on nuclear deterrence, okay? That's why it was started. And you know the two names of the people, and this is before Joe wrote Soft Power. Convince them to have the Aspen Strategy Group focus on global health. And you couldn't have even asked your question because no one thought it was a security issue. It took so much for people to understand that it is essential and that it is part of our soft power. And so we are now at a place, and can't agree with more with Helene in terms of the both on that answer. Okay, gentleman in the back, blue shirt, cuffs there, yes, you.
We have about
Good
20
morning.
minutes to want to cluster some.
Okay, good idea. Helene is suggesting clustering. We're going to do it. We're going to take 3, so give us your name, your question, and we're going to get 2 more.
Okay, good morning. My name is Isaac Hawkins. I'm a senior at Georgetown University. And my question is, given the recent budget cuts in DHS and the U.S. expressed withdrawal from the WHO, how can like private organizations like the Gates Foundation fill that gap? And is there enough funding there?
Great. This woman right here, blue. Yes.
Hi, my name is Emma Coffey. I'm from Virginia Commonwealth University. I'm an undergrad. My question is about PEPFAR specifically. I was just wondering where you stand on the future of HIV and AIDS testing, prevention, and retention around the world, especially since the U.S. is cutting funding to USAID.
Can you pass it that way? I think there was a question right there. Yes. Oh, we've got another one on that side.
Thank you.
Okay.
Hi, my name is Maggie Passerenti. I'm a recent graduate of Minerva University and a research assistant for Nouriel Rubini. And I had a question actually about your experience working with the Gates Foundation. So you mentioned having to battle the stigma when you were implementing these programs in India for HIV and AIDS. And I was wondering, what was the capacity you were given to explore with that? Were you able to run randomized control trials? Were you able to give financial incentives for people to participate in your programs? And what did you find to be most effective or maybe even ineffective when you were able to really design these programs for people in these communities in a foreign country, which is so incredible. So I'd love to hear more about your experience.
Okay, we're going to get the gentleman behind you. I know I said 3, but we're going to make it 4.
Thank you so much for joining us. And so my name is Mehir Kandarpa. I am a MPH student at the George Washington University focused on global health, and I also work at Homeland Security's contractor focused on biosecurity. So my question is, this is a really challenging time for us in global health. Obviously, there's a big removal of commitments. And so for the field of global health, and for those of us interested in global health diplomacy, how do we actually advocate for the prioritization of health as a human rights issue, as a security issue, just as a global issue that we should be reprioritizing, especially when we're moving away from development, a bunch of other aid from the US and also in Europe? Thank you.
Great. So I'll try to touch on those. So, the one category of questions is around the cuts, including PEPFAR, and the role that private philanthropy plays in filling some of those gaps. So, there's no way that private philanthropy, even a institution as large as the Gates Foundation, can fill the gaps that we think we have, and a lot of that is still being sorted out. But I think what private philanthropy can do, and one of the things that Gates Foundation is focused on, is looking at ways of health delivery and service delivery that's more efficient and more effective. I think we all recognize that even though these massive cuts and rolling back commitments to organizations like WHO, USAID, et cetera, that these cuts are serious and will have potentially, a lot of impact on lives lost, et cetera. But we also know that, government funded programs and programs in general don't always operate as efficiently and effectively as they can. And there's room for understanding how to be more effective. I think that the role of AI, for instance, in delivering information and helping to make service delivery more economically efficient could make a big difference. And so I think that that's where private philanthropy and other dollars will probably focus on. How do you take this moment and think about increasing the effectiveness of programs and the efficiency of programs? And again, there is no way to fill the gaps, the financial gaps, but there are ways of showing greater effectiveness. I think the question about PEPFAR, I think it's serious. PEPFAR has saved many, many lives, and the moment you no longer have those drugs available, people are going to die. And so I think thinking about, again, service delivery, how can it be more effective? But also, I think, we've got to have strong advocacy groups that really help to point out why it's so important to keep some of our commitments that we're kind of scaling back on. So, I think better service delivery, more efficiency, but also increasing advocacy around these very important issues. The question about the programs in India, I know this may sound redundant, but again, I think the more we work in partnership with, as we often talk about the natural owners. So the natural owners in any country for public health and public goods is the government. So we did a lot of partnering in India with the Indian government, but we also did a lot of partnering for some of the things that you mentioned around overcoming some of the stigma and issues with communities themselves. And I could go on, we don't have the time, but about the different ways in which we worked with communities in a way that elevated their voices so that they were able to actually help to destigmatize and help to really change the way people thought about HIV and HIV prevention. And the last question was?
Advocacy. How to do.
And I think, being able to work with organizations who that's their role is critically important. And so, back to the question about the Gates Foundation, I think over time, the Gates Foundation has funded more organizations that will advocate for the issues that, they're trying to have an impact on. So I think just really figuring out what are the organizations that are most effective and efficient in the advocacy arena. And, that's an opportunity for helping to elevate your voice in a way that's, multiplies what you may want to, see happen.
Okay, we're going to get two more. Quick. Right here and right there.
Hi, thank you, Dr. Gale, for speaking to us. My name is Jupiter Huang. I'm a master's student at Georgetown studying security studies, and I'm just curious. I also work in nuclear policy, which is another field where prevention is the goal, and you can't tell someone, I succeeded, there's no war. And so I appreciated that. But I wanted to ask you about institution building, because you started at the Bill and Melinda Gates Foundation when it was, a very small institution. So how did you approach, building that institution to achieve the kind of mission that you wanted to go? Like, how do you drive people, motivate people, and advocate for that as you're starting out? And any advice that you could give us as we look to do similar things would be amazing. Thank you.
Gentleman right there.
Thank you very much for being here today. My name is Justin Lee. I'm a PhD student at the University of Wisconsin-Madison in sociology and a summer associate at RAND. My question is about kind of how you balance commitment to like community, particularly like where you might have come from, where people in this room have come from, like where we grew up, with our interactions with the international community, with the institutions that we need to actually be involved with, that have power, that have influence, with like perhaps the people that we grew up with, or like that kind of struggle to both work in fields that have impact with people and organizations that have power and impact, but still remain connected and serve the communities where we're from.
All right.
Yeah.
Institutions,
Your institution building.
institutions, connection to your community.
Yeah, and they're kind of interconnected in some ways. So when you say the Gates Foundation, now clearly the Gates Foundation had Bill and Melinda, who were the ones who decided where they wanted the organization to go. I mean, when we first went there, you know, they would say, well, we don't think we need an institution full of lots of experts. We're just going to make grants. And in the very early days, you know, you could practically write on a napkin and hand it to somebody and get your proposal, funded. You know, I think, but they were very clear from the very beginning that what they wanted was impact, and that impact would drive how the institution developed. And because of the kinds of problems they took on, which were these big global problems in, in health, in development, and in education, it took building an institution to actually support that. So I think if you're driven by what's the impact that you want to have, then let the institution follow the impact and the needs for that. So I don't know, you were very instrumental in developing global development, which wasn't a strand in the very early days. When I first went there, which is about the same time, the whole global health program could sit around a desk, around a table. I mean, today there are about 1,000 people who work in global health. Global development, the same. I mean, you were global development for a minute by yourself, and now, that's like 800 people or so. So, it was following the impact. And I don't know if you have anything.
No, let's go to community.
So, I guess I think we're all complicated individuals who have different, sometimes opposing forces within us. So depending on the community you came from, they may not understand at all why you're interested in a career in global. It's one of the things I faced throughout my career is, people asking, you have a lot of problems at home. Why are you focused on these global issues? And I just think that today in this world where we're more globally interconnected, I think it's easier in some ways to make the argument that it is important domestically to be focused globally, and it's also important globally to understand domestically. I think the United States, which one might argue that right now we may not be showing up globally in the way that we would want, but I do think that people appreciate that, there are lessons to be learned in both directions. And if we want to be, as the United States, a beacon in the rest of the world, it's important for us to also get our house in order. And so I think thinking about those things as not being opposing forces, but actually being mutually reinforcing.
I would just add, it's kind of where we began this question about the forces that shaped, I began there. Stay connected. I would encourage you and urge you to stay connected and listen. As part of the communication, stay connected and listen. Because I think hearing that and knowing that's a part of you is a quite important thing to do throughout, no matter where you go or what you do. Want to thank everybody, thank our folks online as well. Thank you all for joining us.